Today, let us discuss about kids that have a small VSD. What happens is when a child has a small VSD, it has no significance because the child will be asymptomatic. But unfortunately, in a small proportion of these kids, this will cause damage or leakage in the aortic valve. So, kids that have a small VSD, they should be regularly followed up by a pediatric cardiologist, because if on the slightest sign of a leakage in the aortic valve or a prolapse or damage to the aortic valve, these VSDs must be closed, right? Unfortunately, if this is not done in that time, if these VSDs, when the prolapse is already there and these VSDs are not closed, in the future the valve will start leaking, right? And then the problem becomes bigger because now the valve is leaking severely and there's a VSD. So the surgery becomes most often the surgery will be that the valve has to be changed to a mechanical metal valve and the VSD has to be closed. This in itself is a disease because of the mechanical valve. The child will have to be on anticoagulation warfarin for life, which comes with a risk of bleeding, clot forming and everything, right? So it is said that if we change 100 mechanical valves today, by the end of 10 years, 20% of the patients will not be alive because of complications that are related to the anticoagulation. Then what? If there is a child who has a VSD, unfortunately didn't come for the diagnosis was not made in time or was lost to follow-up, and the valve is leaking severely, the best treatment under the situation currently is that the aortic valve should be repaired, which is possible in a majority of kids that have a leakage because of the VSD. Aortic valve is repaired and the VSD is closed. This ensures a much better outcome than replacing it with a mechanical valve.